Good morning, everyone, and welcome to our Thursday morning business chat. We get together on Thursday mornings to get the wisdom from some of our leaders. And this morning we have a very special treat with Dr. Barbara Jennings with us, who is a functional medicine chiropractor out of Fort Collins. And she is here to share. She's also one of our great doctor guests on our introduction to LifeWave on Tuesday evening. She has amazing wisdom to share. And anytime she's on, we all get to learn so much. So this morning I get to welcome Dr. Barbara, and she's going to take over from here. So.
All right. Thank you. You can hear me okay?
We can hear you and we can see you.
Okay, very good. All right. Well, so I was invited to talk about today how I use LifeWave in my practice. And in my business. So really what I'm going to cover today, how I was introduced to LifeWave in an effective way, how I introduce it to my patients, and then third, how I actually, the logistics of how I use it in my business. And first of all, I just want to say, I wouldn't use it if it didn't work. Right, I wouldn't still be here and doing any part of it if it didn't work. So that is my number one goal as a practitioner, is to help my patients. So I was introduced to LifeWave phototherapy patches through my friend Michelle Niels, who I've known since we think about maybe 2003, so a long time. She used to attend my NIA classes at the health club, and we became friends that way. So we actually had a long history, and I was willing to listen to her probably more than I would someone else I didn't know as well. And she invited me to lunch and told me about the patches. And to be honest, so I'm sharing this experience with you because if you're going to talk to any kind of practitioner, it's probably going to be similar. Because when she started telling me about something that I thought, okay, well, she's selling this thing, I sort of had this knee-jerk reaction of, oh, okay, another one. So, something somebody's selling and pitching to me. Because as a chiropractor, I have been approached by so many people for so many things, especially network marketing products. So name a health-related network marketing product or program, and I've heard it. It's been pitched to me more than once. So if you're going to talk to a chiropractor, a naturopath, any kind of practitioner, you need to know they've probably been approached a lot by a lot of different people for a lot of different things, and they may have the same kind of, reflexive reaction, like, oh, another one of those, I don't need it. I already have something for that. I already have what I need. So I have said no to nearly every MLM product out there because I already have access to excellent, the best effective nutrition supplements and detox products, professional lines that are sold to only doctors. You can only get them through your practitioner. So usually I've already got something. It's easy for me to say no because I already have something that can do that. A lot of MLM products are often very good, but they're not unique, right? As professionals, I have something for almost everything. They may be good, but they're not unique, and especially not unique to doctors. But there are two things that Michelle said that pulled me back to really focusing on her and what she was saying, and that was the GHK copper peptide. Like, I've heard of that before, and increased stem cells. Now, stem cells, that's not something that I already had to offer people. I know they're great, but that was something that was new to me and a unique product. So, I knew there were many benefits to stem cells that I couldn't offer in a supplement or in an adjustment or, probably not even in a lifestyle change. And I didn't want to hire a PA and change my entire office setup to be compliant for working with blood and injections. So I thought, this may be a way for me to offer stem cell benefits to my patients much more easily and affordably. So that is really what piqued my interest and motivated me to look closer. Now, it's important that Michelle followed up with me because I don't have a lot of downtime and I have a lot of things to read. And the 2 articles she gave me, they were very good, but they weren't urgent. They were not urgent for me. So I didn't read them right away. So it was important that she followed up with me. I don't know how many days, I don't remember, but she did twice. And both times I hadn't read them. So I finally did, thanks to her persistence. So after I learned a little bit more, I thought, okay, I'm going to try them on me and my husband. So I got a gold kit that gave us 2.5 months each to try. But after 5 days, I felt results, right? I felt more energy. I felt better. I was sleeping better. So I decided to tell just a few select patients about them, people I knew could use them. And of course, they wanted to try them right away. So after they had really good results, away we went. A few weeks later, I upgraded to a diamond kit so that I could have an inventory in my office. And I sold that whole diamond kit probably in 4 or 5 weeks. And I only work 3 days a week. So once I understood what they did and saw some results with not just myself, but some patients with some pretty significant things, I was in. So one more thing, it's safe to assume, if you're going to be talking to a practitioner, it's safe to assume they don't have much time. And, I don't usually go to lunch with people who want to show me a product. I just happen to really like Michelle. So Robin has a really excellent technique that I've heard her share several times, and that is ask the person when you begin talking, are you the kind of person who likes a lot of information, just the facts, or somewhere in between? And then be prepared for each option, right? Respect their answer. If they only want a little bit, you need to have a well-prepared, short segment, short, but potent spiel to share, right? Give the best, the most pertinent information in 2 minutes or 5 minutes. So I really recommend practicing that. Practice being efficient in your delivery of quality information. You may only get that one opportunity. So how I introduce this to my patients, really one of the top takeaways I want you to leave with is to always pre-frame possible outcomes, not just what you hope for them, but all the possible outcomes. If you tell a person ahead of time what could happen, then they're probably going to experience one of those things. It won't be a surprise and it won't be a disappointment. That's the key. So, they may notice something the first day or in a week or in a month or 2 to 3 months. But if you tell them in advance of the things they may or may not feel, it builds trust in you and it builds trust in the product. When a person decides it's not working for them after 2 weeks and gives up on the patches, that person has not been properly educated or given proper expectations. So to show you how important that is, a patient I'll call Sally came in just the other day on Tuesday, and she came to see me for chronic gut issues. So I am working her through my gut cleanse and repair program, which is fantastic, right? It works really well, but the first 3 weeks can be a little bit rough. So I told her, look, in the first 3 weeks, as candida is dying off, as parasites and bacteria are dying off, gas is created. So you may experience more bloating, right? You may feel rumbling and grumbling and gas and diarrhea, and it tends to peak between day 10 and 15, and then it declines after that, and it's usually resolved after about 21 days. So she came in and said, well, I'm having all of these, lots of gas, lots of bloating. It's really uncomfortable. And I said, well, what day are you on? Well, I'm on day 16. I said, you are right on schedule. Remember, I told you it peaks around there. So you've just gone through the worst of it. And then she could relax and she didn't worry and she trusted the process. Now, I've done this hundreds of times, so I know the process well, but she doesn't. But the main thing is she didn't quit, right? She's following through on the protocol, and I know it's going to work in the long run. So it's important if there's something negative that might happen, I'll get to that a little bit later, that you give them a heads up about that. So I also like to share other people's experience to show that results vary. Right? Mary Beth had severe shoulder and hip pain. She experienced 40% less pain after about 90 minutes. I mean, really fast. I felt more energy in 5 days. Kay had severe foot pain for 15 years. And after 30 days, she had noticeable pain relief. And after 5 months, she had complete relief of her pain. So I like to tell that one because you see it sets up the idea of long-term use, right? That I could get some results in 1 month, but even better results after 5 months. Another woman with a bad hip, she started using the patches and all she felt was tired. She was tired for 3 months. And then in the 4th month, way more energy, way less hip pain. So it's important to let people know results are not predictable for them or anyone, and that there's a wide range of possibilities. So that's especially true with the glutathione patch. I just told our mastermind group the other day, in my experience, it really has the most volatile of possible effects. Most people are going to be fine with it, but if someone's had chemotherapy, if someone has a lot of toxic accumulation or poor liver function, it could make that person nauseous, could make them really sick within just a few hours. So if you tell them that might happen, then they're not disappointed or scared or angry. Okay, so in my office, LifeWave is probably the easiest and most effective way to introduce people to the patches, right? Especially in a chiropractic office, physical therapy, massage therapy, where people have pain, LifeWave is going to be a good fit. So if a person is in pain and I have a good relationship with them, right? They already know me. I may ask, would you like to try a phototherapy patch to see if it relieves your pain? And they'll say, what's that? And I'll show them the patch. And I say, it's activated by your body heat. It usually works really fast. They always say yes. So I don't take off the paper, right? I just put it on them. I put the brown one on and I say, we're going to try different places with this white one to see which spot works best. And then we find the spot and they say, wow, how does that work? And it's a very predictable conversation. And then I explain sorry, I need some water. Your body heat is infrared light, and the patch contains organic reflective crystals and nanotechnology. That's it, no medicine. You're not going to absorb anything through the patch, into your skin. When your light hits the patch, the crystals reflect it back into your skin, but the nanotechnology changes the frequency of light. So your skin is stimulated by a frequency that has a specific and desired effect. And this one relieves pain, right? Keep it simple. And then if it feels right, depending on their needs and the person, I may point to that one, right? I may point to X39 and say, that patch reflects a light frequency that stimulates a copper peptide and stem cell production. Or if it's a woman who I think may need SP6, I may point to that and say, that one has a light frequency that helps balance hormones and metabolism and cravings. So usually I will sell individual patches first. So I do keep an inventory. I try to keep some of every patch. I don't always have some of every patch because people do buy them. But maybe they only buy the patches that I put on them in that appointment. Or if they want more, sometimes they'll want enough for 5 days or a week. So I'll sell them individually. Then next visit, I'll ask them, how did it go with those patches? And if they want more, I'll ask them if they'd like to buy them in my office at retail, or would they be interested in getting the wholesale price? And then, I have a quick explanation of the difference between a preferred customer versus wholesale account. Also, I don't keep all of those leads to myself. Sometimes I do share them with some of my builders. So now, if you know a person has an old injury or a chronic condition, or they've had a bad knee for a long time, tell them about retracing. Tell them that most people feel more energy within days of using X39, but some people feel nothing. And some may even feel a recurrence of symptoms or an exacerbation of pain. All of these are normal, and all of them mean it's working. If a person has more pain, explain there's a logical sequence to healing. Retracing can happen as the body undoes an injury. Our bodies always work in a sequence. There is a sequence to becoming ill. There's a sequence for cartilage wearing down. There's a sequence in developing inflammation. And there's a sequence to undo damage and repairing tissues. The body doesn't skip steps, right? That's really important to know. The body will not skip steps. It has to take all the steps. And sometimes repairing will, when the body's repairing, those old and damaged cells will slough off, and they don't just magically disappear. They don't instantly disappear. They're removed and they still exist, right? So they're cleaned up. The body has a way of cleaning them up and getting them out. There's a lot of phagocytosis, right? The white blood cells will come and eat some of it, or the lymphatic system will pick up the debris and carry it out. But it takes time to do that, and it's a normal process. If a person is more tired, it can happen because healing and repair takes a lot of energy, right? There's a lot of makeup work for your body to do. The older you are, there's probably more makeup work in the repair process to do. So for a time, your body may divert energy inward towards the healing process, leaving you with less energy for your muscles to move around with, right? We heal mostly during sleep for a reason. That's because the energy is used internally, while during the day it's used for outward work. So one other thing I want to share, just 1 second. I don't usually introduce the patches to a brand new patient. And I learned this lesson kind of the hard way, right? Unless they're in pain, then I may introduce the LifeWave patch. But we learn from mistakes, right? So here's an experience I learned from that I'll share with you because it's an important one. So last year, I had a new patient recommended to me, right? She came with mast cells out of control, allergies out of control, a lot. And I told her about X39. I explained how it works. I explained how awesome it is, along with, other recommendations that I knew would help her. When she left, she'd say, she said, all right, I'll take a look. So I never heard from her again. And then quite a bit later, a few months later, I discovered she'd left me a bad Google review and mentioned that I tried to sell her a network marketing product, and I never saw her again, right? So this was a woman who was referred to me by someone who does know me, but she did not know me well enough, right? I did not yet have a relationship established with a relationship of trust with her. So, of course, I thought, lady, if you'd only tried it, it would have helped and you would have seen. But my takeaway from that is I need to build that relationship first, even when I see a person I know needs the patch and needs X39 is going to benefit so much. I need to spend some time with my relationship, right? Even a doctor-patient relationship, especially a doctor-patient relationship. I lost the opportunity to help that lady because I got ahead of that. So lesson learned. All right. I've got just a little bit more, Robin, then I'll be done.
Great.
Okay, so how I use the patches and the LifeWave business in my chiropractic business. Number one, I do keep an inventory, as I've shared. I sell retail prices, both individual patches and full sleeves. What I use the most as a chiropractor is X39, SP6, LifeWave, Eon, and glutathione. Probably in that order. LifeWave, X39, SP6, those are my top three. And then Eon and glutathione after that. I do teach people that the LifeWave patch is the get me out of pain now patch, so I can get through my day or so I can sleep through the night. Whereas the X39 is more of the long term. They may have a short term quick reaction and result with X39, but the real goal there is the long term healing capacity to increase the body's ability to repair. And I explained to them the longer you have a greater supply of both the copper peptide and stem cells, the more time your body has to use to repair, right? And as I mentioned, we all have makeup work, right? The wear and tear at some point in our body, in our life, gets out of balance with the repair process. So that's exactly what I tell people, especially with X39. Because stem cells decline as we age, there's probably a lot of makeup work your body needs to do. So it loses the ability to keep up with daily wear and tear, damage, inflammation, injuries, and so on. And always remember, tell them it can make them tired. Don't be too discouraged or disappointed if it makes you tired. It's a sign good things are happening inside. So when you're talking to other healthcare practitioners, you can use the already existing guide, Benefits for Healthcare Practitioners. That gives you some really good talking points for practitioners. It lays out specific benefits and talking points that may really speak to a certain type of practitioner, some more than others, you'll see. If you're talking to doctors who already offer stem cell injections, I don't know if they'll be interested in the patches. They may. Maybe they like the idea of prolonging the benefits. They're probably not going to want to give up their injections, though, because those are big money makers. Also, don't take it personally if a doctor doesn't want to listen. It might be a bad time. They might be really busy. Maybe they've heard more product pitches than they've wanted to hear. And it's not about you. It's not about the product. It's just about, oh, it's another one. Like I mentioned at the beginning. So, doctors are real, normal people. They have their own bodies. They have aches and pains and energy and sleep and addictions and ADD and depression and every problem out there. So they don't all walk the talk that they may be preaching. Some don't even know the talk very well, but they all want to feel good. So sometimes a doctor may want to use it for themselves, even if they're not able maybe to use it in their practice. So I hope, take these things into consideration, offer samples. Doctors are used to getting samples, and don't be afraid to talk.
Fabulous. Oh my goodness. That was so wonderful, Dr. Barbara. Can you stick around for a few questions?
Yes, I can.
Great. So if you have a question, raise your hand or unmute your line. I do want to just, what you said in the beginning about practice what you're going to send to people, be prepared. It makes a big difference in how Michelle approached you, because you had a relationship. And that's an important thing for people to realize. If you're going to approach a practitioner, approach one you have a relationship with. And sharing stories and managing expectations, brilliant. That combination, because people get of all kinds of expectations, and by sharing those stories, it gives people a sense of what's possible and what might happen to them or might not. And also the long game, which is having people really commit to the product for a while, because it takes time. It didn't happen overnight. What's going on? And I like the way you say you start with a single patch, and then they can purchase a few, and then they have the option wholesale or retail. That was wonderful. And I love also the logical sequence to healing. That's really, really helpful. So the one thing that Dr. Barbara does that I don't recommend you guys do, when she's being a doctor, she's the expert. And so she's going to explain what's going on. But for those of us that are not doctors, we want to point to the tools. When Barbara is outside of her practice, she's Barbara, not Dr. Barbara, and she uses the tools. But when she's in her practice, she's Dr. Barbara, and she's the expert. So I see a hand up. I think it's Myrna. So who was it? So why don't you unmute your line? And yes, there you go. Why don't you unmute your line and ask your question? And then Michelle.
Yeah. Hi, Dr. Barbara. Thank you so much for this presentation. It's very concise and very informative. I have a question regarding the tracing. How long usually is it?
Oh, the $1 million question. No way to know. That is not something you can predict. I've had people tell me it lasted 1 day. I think the longest that I've seen someone feel that way is probably 2 weeks. So, I think the good news is it's not very long. But, if it brings up, exacerbates a pain or an ache or an inflammation area, 2 weeks is kind of a long time to slug through that. But if they know what's happening, then hopefully they will stick with it, right? Sometimes they need encouragement. Sometimes you're a cheerleader.
Great, thank you. Could be hours, could be days, it could be weeks, but it will pass and things will be better, won't they?
Yes.
Okay, Michelle.
Good morning, Dr. Barbara. That was beautiful. So many kudos to you in the chat. Everybody loved this. We're talking about approaching someone that you know and trust. I would like to approach a holistic practice of a nurse and a chiropractor. I don't know them. They have a couple of patients who have used the patches, and they use some type of kinesiology, and they were told, these clients of theirs who were patch users of mine, they were told by these practitioners, these are amazing, and they came up really good on their whatever their machine was that they were testing. And so they do have a little bit of experience. I did reach out to these practitioners with an email and I heard nothing back. So what would be your recommendation, Dr. Barbara, for me approaching, should I call and like make an appointment and just say who I am, and I'm a representative, I'm a independent representative of a scientific research and development company? I mean, what would you think would be the best way to approach someone that I don't actually know?
Yeah, well, so I can tell you what Dr. Nicholas did. He cold called. He literally got the phone book out and cold called hundreds and hundreds of chiropractors and introduced himself as a rep in the area for this company of phototherapy patches, and would they be open to some samples? So that's always a possibility. I think you could do either one. You know, you can try dropping in. That's always, you know, a question mark if you'll find somebody who has any time to talk with you or listen. It would be also perfectly fine to call and ask when a good time to stop by. I would call, so I would offer samples. I would ask if they would be open to, you know, a few samples for pain relief or to activate stem cells, so they could try it. They'll want to try it themselves, and they may have a few special patients they want to try it on.
Great.
Perfect. Okay, thank you. I have a plan.
Okay,
Okay.
so we've got a lot of hands up, so let's be really brief and we'll end it with Helen. If you're willing to stick around for a few more minutes, Dr. Barbara.
I'm good.
Okay, great. So David, you're next.
Thank you so much, Dr. Barbara. We always get so much information from you. Love it when you come on. You just answered the first question I had about how to approach, you know, how do you go? Do you just cold call or anything? The second question is, when you get a practitioner that is very technical and all, and they want to see data and all of that, is there any particular report or anything that you sent to them? Like, is it the one that was in the peer review, or is there a particular report that you'd like to give them?
That's a really good question, David. You can always give them the white paper. In fact, Michelle, I would suggest bringing a hard copy of the white paper, because they may not click on a link, right? So that one is good, especially if you want to, if you think there's a particular focus or interest of that practitioner, you might highlight it and, or, you know, put a flag, sticky note next to it or something to draw their attention to that. The X39 studies are very good. Those, you know, they're great studies with great results. There's a really good one or more on the glutathione patch. I like that one. The studies that were done at the University of Texas, El Paso. So those are good. You know, I spent a couple of nights, I just devoted several hours, 2 or 3 times, to look at all the studies in the science section. And there are some really good ones in there. Now, depending on your practitioner, you know, if it's a data person who wants to see the studies, then I wouldn't give them the energy, you know, the energy measuring studies. I would give them, you know, the double-blind placebo-controlled studies. But, you know, if you've got an acupuncturist, they may love to see the studies on the changes in energy with the energy enhancer patch.
Got it. Thank you so much. Bless you guys.
Welcome. Anyone else?
Robin was
Yes.
muted.
Oh,
So it
yes.
looks like Sybil.
Sybil's next. Sorry, I was muted. Sybil, you want to unmute your line? Great.
Hi, thank you. I fell 3 weeks ago tomorrow at a Mexican restaurant and broke 2 ribs, 8 and 9. And I made it home. I didn't go in the ambulance. And I had patches on and I didn't bruise, which was kind of amazing because I'm usually bruised badly and it was a very hard fall. But the the next day I couldn't even hardly move out of my chair to go find my patches until the nighttime. It was just so hard to get up, get down, go, go to the restroom and all that. But when I did get the patches, they did cut the pain from unbearable to tolerable. But I hear some people say, oh, I broke, my mother broke her ankle and she has no pain at all. Well, you know what? It's 3 weeks. I still have some pain and have to be careful. And I'm using practically all the patches. In the daytime, I use X39 and LifeWave and energy enhancers and SP6. And at nighttime, I use Nirvana and Silent Night and Carnosine and Eon and probably something else. But is there anything you can suggest that might help me to heal faster or have less pain?
Well, it sounds like you know what to do with your patches. Tomorrow will be 2 weeks since I broke my ankle, and the night of and the day after I broke my ankle, it hurt really bad. I was literally, now I'm a person, I don't take medicine. I don't take Tylenol. I don't get headaches. I never take things. But I ended up taking ibuprofen. I put the LifeWave on it, and just like you, it wasn't a dramatic, whoa, my pain's all gone, but it did take the edge off. It at least helped me stop literally squirming in pain on the couch. So
take the edge off. It did take the edge off, and I do feel like I'm healing pretty good now. One day I got really sick. I threw up all day, and that was because it hurt so bad to go to the restroom. I didn't drink enough water. I probably detoxed too fast. That's what I'm thinking. But now,
well, if you're using glutathione, that may very well be the case. The more experience I have with that with new people, I really recommend they start with 4 hours. Just, take it off after 4 hours and wear it again the next day for 4 hours and the next day again for 4 hours. That's one patch, but it's anytime you suddenly increase glutathione, it works, right? And glutathione is a potent antioxidant. And when you purge toxins faster than your kidneys, liver, and skin can clear them, you're going to feel sick.
Okay, let's be brief for the last two. We have Teresa and Helen, and then we'll close it up for the day. And this is fabulous information. Thank you, Dr. Barbara. I think a lot of people are gleaning some great comments for you. So Teresa, you're next. Then Helen. I think you're unmuted, Teresa. We can't hear you. All right, we'll come back to you and have Helen, why don't you and Tim unmute and see what you want to share?
Yeah, well, I see Mary Rudy, you're on. If you want to unmute and ask your question that you were asking on the Facebook group, or would you like me to ask it?
Well, I just had, I bought on my computer so I could ask it. I proposed a chiropractor, no, a naturopath who I've been working with for years with his wife, gave him patches. He experienced that, wow, they worked on my shoulder. But he said, I would lose credibility with my patients if I cover anything in my office that is sold through an MLM, company. And he looked at the research and he tried them and it worked. He said, yeah, they worked on my shoulder. What do you say?
I say he probably needs to look more at the research, and he needs to understand what the options are. If he wants to be able to offer the benefits, the many benefits of these patches, then, if he wants his patients to benefit from stem cells, right? He could use these patches, or he can refer them away to spend $10,000 for a stem cell injection that will go in one joint one time and may or may not work. There's not a lot you can do if somebody has a a really set opinion about a network marketing company, right? I told a friend dentist of mine about these patches. He was talking to me about his chronic neck pain. He's a dentist, you know, and I said, well, one thing you could do is use this patch. Initially, he was really interested when I was explaining it to him, and then just nothing, you know, just crickets, never mentioned it again. I sent him 2 emails, no reply, right? So to me, that just means he's closed. Doesn't matter what the product is. Some people are just, if it's an MLM, it's an automatic no. Some people might be willing to change their mind. I don't feel like it's a credibility issue to me, because number one, I don't try to hide that it's an MLM. I, you know, talk about the elephant in the room. It's the best way to take the air out of it, right? Say, yeah, it's a direct sales company, but I've looked, and here's the other options that you have. You know, I can refer you for a $10,000 injection, or I can have these available to you. Or you can do a water fast for 5 days and increase your stem cells that way.
I have one more quick question. I have a dentist friend who was very skeptical, but he just fell, broke his hip and had an immediate hip replacement surgery. And now he said, get me the patches. What should I use? Tell me what to do. So I was texting Robin, like, what should he order? You know, hip replacement surgery. He's on pain meds. He's doing physical therapy. But what would you say? I mean, I said X39, LifeWave, glutathione, and Eon. And then that way, but I don't know if he should just start with X39 to feel it, but was just so dramatic.
Do you know what? Somebody like that, they're in pain. They, you know, there's a crisis in their body. I wouldn't hesitate to encourage more. You want them to get results, right? You want them to have the best possible result. And with something like that, I would recommend the glutathione and Eon, certainly the LifeWave, and of course the X39.
And would you recommend them all on that spot that they just had the surgery on?
I think so. What I'm doing with my broken bone is I'm alternating X39 on my ankle and then under my navel. And just because, you know, one's going to be more systemic, one's going to be a little more local, you know, just by a little bit. So I like the idea of alternating that one, but yes, in that area for the glutathione and the Eon, depending on, you know, I would probably go front to back, side and front, put them on 2 different places. I wouldn't put them next to each other. I would try to go opposite sides of the joint, front and back or side to side.
Okay.
That's great information. Well, thank you. Thank you. We got Teresa. Are you able to share as our final question?
Yes, I am. Are you? Can you hear me?
Yes, great.
Yes. Okay, I just had a question regarding, you say to give samples. How many samples are you recommending to give to practitioners?
Good question. It depends. It depends on who they are, what they do, what they're going to be using them for. If you have somebody who wants to try it themselves, then that's you know, that's a really good situation. You know, if I'm sharing samples, I usually give 5 days worth, but that's only because I didn't feel anything for 5 days. On the 5th day, I did. But I always tell them, you might feel something on day 1, 2, 3, 4, or not until day 30 or 50. So you may or may not notice anything with these. So, you know, there is a con to giving samples, because if you give them 5 days and they feel nothing, then they're like, oh, it doesn't work. So you know, it's not a perfect practice. And, you know, I think you really just need to assess the situation. Who are you talking to? How are they going to use it? Do they have something? You know, if you've got a chiropractor with his own back pain, lots of chiropractors have bad wrists and elbows and shoulders. And, you know, maybe they'll want to try LifeWave or X39 on themselves first. And, you know, according to your budget, what can you afford to give them? Can you afford to give them a whole month? That would be awesome.
Okay. Well, thank you, Dr. Barbara. That was really amazing. I think we could spend all day doing Q&A with you. It's been 2 years that you've been using and incorporating the patches in your practice, and you're a leader in our business. And so you're building the business and you're being a doctor, and you're learning when's the time to be an expert and when's the time to take the hat off and be a networking professional. And it's beautiful. It's really beautiful to watch. So thank you everyone for joining us today. This was really a fabulous call. It will be in Live Younger YouTube tomorrow. And so at this time, we're going to complete our call, and have a wonderful rest of your day, everybody. Thank you.
Robin,
Yes.
Robin, Sarah asked where she can find the handout benefits for health practitioners.
Yes.
That's in the Facebook group, right?
Yeah, and it's also in Nitty Gritty, and it's in the Facebook group. And Dr. Barbara is available for consults. Let's make sure everybody has your number, because I know that really works for everybody. You want to type that in for everybody, how they best reach you?
Yeah.
Because she does phone consults, and people have had amazing experience getting, their unique situations. Okay, there you go, everybody.
All right. You can save that.
377-9611, I think.
Yeah.
Yep.
Yeah. 970-377-9611.
Okay. Well, if everyone wants to unmute and say
What is
thank you to Dr. Barbara, we'll end our call.
377-9611.
Thank you.
Thank you. Wow.
Thank you so
Barbara.
much.
You.
Thank you so much. It was fantastic.
It was fantastic. Thank you.
Bye.
Thank
Bye.
you.
Thank you.
Thank you.
Very helpful. So helpful. Thank you.
Thank you
so
all. Glad to do it.
Thank you, Dr. Barbara.
Helpful.
The great.